Measuring intake and output. If I&O measurement has been ordered by a healthcare professional, it is very important to be consistent and accurate in documenting all the fluid intake and output a person has. Intake is any fluid a person consumes, drinks. Measure any fluid the person takes in, as well as any food item that turns to liquid at room temperature, such as Jell-O or ice cream. Output is any fluid that passes out of the body, including urine, liquid stool, vomit. Liquids can be measured in cubic centimeters, milliliters, or in ounces. Measure fluids the person wants before they consume them, and document the amount the person consumed when they are done. When measuring output, ask the person to use a urinal, bedpan, or plastic hat that can be placed beneath the toilet seat. Equipment for collecting and measuring output, such as measuring cups, bedpans, urinals, and plastic hats that go on the toilet, can be purchased at a drugstore. When feces is mixed with urine, it will cause inaccurate measurement. Be sure to note the presence of the feces in the documentation if that occurs. If the person vomits, document the frequency and color of the vomit and estimate the amount. Before documenting the weight of a person's incontinence briefs, the dry weight of the brief should be subtracted from the weight when wet. Empty ostomy or catheter urine collection bags into a measuring container to determine the output amount. Report the results of I&O to a healthcare professional as directed. See Department of Developmental Disabilities website for a sample form for documenting only intake and a form for documenting intake and output. Steps for basic measuring of bodily intake and output. Intake. Ek, check mayar tar. For I&O orders. 2. Wash hands and put on gloves. 3. Gather supplies and equipment. 4. Identify the person and explain the procedure. 5. Measure the liquids to be consumed before giving them to the person. 6. Remove gloves and wash hands. 7. After they finish consuming as much as they want, wash hands and put on gloves. 8. Measure the remaining amount of liquid. Subtract the remaining amount from the original amount to determine how much was consumed. 9. Clean all equipment appropriately. 10. Remove gloves and wash hands. 11. Document the amount of intake. Output. Ek, check mayar tar. For I&O orders. 2. Wash hands and put on gloves. 3. Gather supplies and equipment. 4. Identify the person and explain the procedure. 5. Measure liquid output before flushing or disposing of appropriately. 6. Clean all equipment appropriately. 7. Remove gloves and wash hands. 8. Document the output measured.